The following is a KMEH-TV special medical report with Margot Myers and Dick Foley.
For patients and families at Evergreen Health, it has been a very good year for quality and safety.
And heightened aspirations for even greater safety and quality at Evergreen Health in 2015.
Outstanding performance during its annual accreditation at Evergreen Health Monroe.
Using Muse to identify deteriorating patients.
Using magnet principles to help guide nursing practices.
Those are just some of the stories we'll be reporting on in today's broadcast.
We begin with the exceptional year for quality and safety at Evergreen Health. During the past year, Evergreen Health won recognition from external judges such as Healthgrades, the American Heart Association and American Stroke Association, Consumer Reports, the Centers for Medicare and Medicaid Services, otherwise known as CMS, and the Washington Hospital Association, which named Evergreen Health baby-friendly. The CMS recognition made a tangible difference not only to Evergreen Health's reputation for quality and safety, but also to its bottom line. CMS now uses value-based purchasing. Under value-based purchasing, hospitals can be financially rewarded for good performance and penalized for poor performance. Because of its good performance, Evergreen Health was awarded a nearly 0.5% increase in its base operating DRG payment amount. Moreover, Evergreen Health was one of only 2 hospitals in the state that did not receive a penalty this year for 30-day readmissions. This is the 4th consecutive year that Evergreen Health has not received a penalty. In addition, Evergreen Health received no penalty for hospital-acquired conditions. Finally, Evergreen Health received 4 out of 5 stars from CMS for its overall hospital quality, putting it in the top 11% of hospitals in the country. The American Heart Association and American Stroke Association honored Evergreen Health with the Get With the Guidelines Stroke Gold Plus Quality Achievement Award. The award goes to hospitals for implementing specific quality improvement measures outlined by the 2 associations for the treatment of stroke patients. Evergreen Health also received the association's Target Stroke Honor Roll for meeting stroke quality measures that reduce the time between hospital arrival and treatment with TPA, the clotbuster drug. Consumer Reports cited both Evergreen Health Monroe and Evergreen Health Kirkland in its special issue rating hospitals on infection control. Evergreen Health Monroe was the number 3 hospital in the state and number 2 in King Snohomish counties, reporting data for C. diff infections. Evergreen Health Kirkland was number 7 in the state and number 4 in King Snohomish counties, reporting data from CLABSIs, SSIS, COTI, MRSA, and C. diff. The results were based on a 5-point scale, rating hospitals from best 0 infections to worst, more than 100% worse than the national baseline set by the Centers for Disease Control. Healthgrades named Evergreen Health among the top 5% of hospitals in the nation for quality. It was the 6th time since 2009 that Evergreen Health was cited as a distinguished hospital for clinical excellence. Healthgrades is the leading online resource for comprehensive information about physicians and hospitals. It releases this distinction annually for the nation's top hospitals based on their clinical outcomes for risk-adjusted mortality and in-hospital complication rates.
A year of even greater aspirations for safety. That's how Dr. Mark Newman, Evergreen Health's Medical Director of Safety, characterizes 2015 at Evergreen Health. The year saw continuing progress on the 4-part safety management system introduced in 2013 and guided by the Board Quality Committee. Highlights of the year include solid achievements with identifying and anticipating safety risks, a growing use of safe links, and major steps to mitigate safety risks. The solid achievements with anticipating safety risks came through a focus on the safety risk assessment component of Evergreen Health's safety management system. It's a new process intended to get ahead of safety issues by being more proactive to prevent possible harm. This year, 15 leaders in an ad hoc safety risk assessment team used a 3-part process that weighted overall harm and potential for harm to prioritize risks. They identified 6 major risks that were significant and needed to be addressed to prevent harm to patients from occurring in the future. The first risk was from medication errors. This risk was reduced by expanding the dose range checking capabilities in Cerner for high-risk drugs.
This year, one of the areas of focus that the team has identified is focusing on dose range checking, which is putting in parameters around medications so that it's easier to detect if a prescribed dose is outside the normal parameters of administration. And so our team this year has built from 20 dose range checking alerts last year to more than 50, with our ultimate goal of determining dose range checking parameters probably of around 150 drugs over the next 5 to 6 months.
The second risk was oversedation. Evergreen Health is taking steps to reduce that risk by expanding central pulse ox monitoring to all postoperative patients on IV narcotics by the end of the year, and by reducing options and standardizing narcotic ordering post-op for spine patients. Third, Evergreen Health is taking steps to reduce the risk of medication errors and delays by continuing to transition from paper-based elements to the electronic medication reconciliation process. Fourth, Evergreen Health's Quality Management Group conducted a failure modes and effects analysis on a new process intended to monitor and prevent patient falls. The analysis provided an opportunity to identify potential failures in the process before it was implemented. Fifth, Evergreen Health has plans in place, long and short term, to reduce safety risks that come from staff and provider fatigue, which is a result of continuously high census. The organization has continued to expand the RN float pool, increased the nurse residency program from 24 in 2012 to more than 90 in 2015, approved a new hospitalist staffing model with an emphasis on night coverage, and will move forward with additional bed capacities in the future. Finally, Evergreen Health has ramped up simulation training to clarify standard processes and roles for clinical staff who respond to code blue and heme alert events.
Your last example, Dick, shows the close relationship between safety risk management and the SafeLink system, whose use has continued to grow this year. The patient safety team provided trend data demonstrating potential risks in response to emergency situations, code blue and heme alerts. That's what we learned from Director of Quality, Kathy Schoenrock.
This year we've had a unique opportunity to identify a couple of emergency situations where we could use some additional practice and some additional standardization. We have developed a simulation training program which we will make available to 1,500 clinical staff across the organization who are called upon to respond to code blue events. That's an opportunity that reflects the organization's commitment to keeping our patients safe. It's taking the time to provide that practice opportunity, to learn the skills, to learn the standard process, so that when folks are called upon to respond to an emergency situation, they know exactly what to do to keep our patients safe.
For more, here's Dr. Mark Newman.
As Kathy alluded to, Evergreen Health's use of our event reporting system, SafeLink, as well as the implementation of our safety management system, which is similar to what's used in aviation, allows us as a team to identify events as they occur, retrospectively review them, and then as a multidisciplinary team, go through those events and identify what we did well and what we can improve on. In the first 9 months of 2015, we've had 27 either root cause analysis or case reviews that have helped us this year, as well as in years past, identify the trend of OB hemorrhages occurring on the obstetrical unit on the average of about 1 time per month. Because of the case reviews, SafeLink, our safety management system, as well as our root cause analyses, we've been able to identify those areas which we can improve and hopefully provide more timely, safer, and more effective care for patients when those events occur.
SafeLink certainly looks like one of Evergreen Health's improvements in 2015. In fact, the use of SafeLink, Evergreen Health's safety reporting system, has been growing exponentially. The system now receives more than 400 reports each month, compared to 150 a few years ago. As of the close of the second quarter, there have been more than 2,400 SafeLink reports. Evergreen Health leadership believes those numbers are a reflection of staff and physicians' growing confidence in the system and the quick response of medical leadership and quality steering committee to the SafeLink reports. Here's more.
As part of our contribution to our journey to quality and safety, the medical staff officers meet weekly to discuss quality and safety issues. These are brought to us either through the SafeLink system or through other methods. The medical staff officers and members of the medical staff office will meet and discuss these issues, whether they have to deal with medical staff quality, behavior, or many times with systems issues. Those that have to deal with medical staff quality and safety are referred to the appropriate section chief for further investigation. Those that have to deal with systems issues are brought to our quality steering committee, which consists of the chief medical officer, the chief nursing officer, the chief operating officer, as well as the 3 medical staff officers and members of the quality office. We meet weekly and we discuss system issues as well as quality and safety issues related to medical staff, quality, and behavior. That way we can address these issues in real time rather than letting them languish for weeks or months. And that's how we're contributing to our journey to absolute safety.
We should note, too, that it is not just the medical center that is seeing greater use of SafeLink. So are the primary and specialty care practices. In fact, as of the most recent quarter, the clinics had received more than 40 events per month, compared with 30 events per month in 2014. The Evergreen Health Medical Group leadership meets weekly to review the reports under the direction of Dr. Ray Baker, chair of the Evergreen Health Medical Group Joint Leadership Council and medical director for musculoskeletal and spine. Thanks to the new structure for EHMG review of SafeLinks, as well as patient complaints, concerns, and compliments, Evergreen Health Medical Group is taking major steps to mitigate safety risks and improve processes that are identified in the SafeLinks review.
Part of what makes the safety system work at Evergreen Health is effective safety communications and safety promotion. A linchpin of the safety communications program is the Community of Safety website on Everlink. The website launched in March 2014. It has easy-to-navigate features that make the site a go-to resource when safety concerns arise. Among those features, you'll find a weekly update on SafeLink reports, an RSS feed on national and local healthcare safety issues, articles on good catches and safety improvements at Evergreen Health. To get to the Community of Safety website, just go to Everlink and then click on the icon. The Evergreen Health team is preparing an educational program for the general public through the Community Health Department. It's called All About Navigating Healthcare, Staying Healthy and Safe. It will launch later this year.
Safety and quality continue to be a major focus this year at Evergreen Health Monroe, too, as well as at Evergreen Health in Kirkland. At Evergreen Health Monroe, collaboration has been the watchword, according to Chief Quality and Compliance Officer Lisa LaPlante. Evergreen Health Monroe's major achievement for the year, says LaPlante, was its performance in its annual accreditation survey conducted by Det Norske Veritas and Germanischer Lloyd, also known as DNV-GL. Monroe cut its serious findings in half, from 7 to 3, and did the same thing for its less serious findings, cutting those from 9 in 2014 to 5 in 2015. Monroe made the switch from Joint Commission accreditation to DNV-GL accreditation 4 years ago. LaPlante says the annual accreditation process with DNV-GL is an ongoing collaborative process that focuses on results. The accreditors closely monitor that you are monitoring yourself to identify your weaknesses and correct them so they stay corrected. Collaboration has also been a key to Monroe's other quality and safety achievements. Monroe has been working collaborative with Evergreen Health Kirkland to rebrand its own Quantro system to become SafeLink and to roll out a Just Culture with a Just Culture algorithm. Collaboration between Monroe and Evergreen Health Kirkland extends to the board level. Evergreen Health board member Chuck Pilcher now sits on the Monroe Board Quality Committee, and LaPlante has been invited to sit on the Evergreen Health Board Quality Committee. Other quality and safety achievements this year at Monroe include being recognized, along with Evergreen Health Kirkland, by WSHA for its falls prevention program. being recognized for achieving best care by Wish's Partnership for Patients and gaining recent coverage on Como News for the Consumer Report's rating on its infection control success. Monroe has not had a hospital-acquired infection for 2.5 years. Implementing a more aggressive hand hygiene program that features hand gel stations nearly every 50 feet in the hospital, organization-wide observer audits, and hygiene champions in every department. Introducing new clinical quality dashboards and implementing a patient safety oversight committee composed of nursing and quality leaders. This committee takes a collaborative approach to analyzing data with real-time identification of trends, pinpointing opportunities for improvement, as well as recognizing and celebrating our successes.
Turning now to the quality as well as safety front at Evergreen Health, the news is all about 2015's 9 initiatives with the goal of achieving better clinical outcomes and absolute safety. The 9 initiatives are safe practices through improvements in documentation, development of an integrated surgical home, 7-day follow-up appointments after discharge, community of safety, absolute safety, population health across the continuum, early detection and warning of the deteriorating patient, preventative health and health maintenance system, evidence-based nursing practice, team-based simulation opportunities. Taken together, the 9 initiatives make up the 2015 plan for Evergreen Health.
Increasing the number of plans of care, gaining greater nursing satisfaction, making the problem lists and progress notes of hospitalists electronic, and expanding the use of Cerner. Those are just some of the highlights of the year for the Clinical Documentation Initiative. The initiative is led by executive sponsor Tom Martin, CIO. Its intent is to create and document processes that capture the care provided and support clinical decision-making across the continuum in a cost-effective way, adding value for the care team. A critical focal point of the initiative is refining nurse documentation. There, a major achievement for the year was tripling the number of plans of care within the Cerner electronic medical record. Plans of care are care templates for a given diagnosis. They encompass everything a patient with a particular diagnosis has to do to get out of the hospital, including reaching goals and milestones for their condition. The electronic plans of care operate like electronic whiteboards, showing nurses at once what a patient must accomplish before being discharged. Nurse satisfaction for the new plans of care has increased 75%. Other nursing documentation improvements include expanding the Care Compass, a task list and care dashboard to health unit coordinators, adding more patient status data to nursing patient tracking boards, which had already replaced the greets boards in the unit hallways. The initiative is also supporting electronic documentation for hospitalists. This year, hospitalists began using the problem list in Cerner to record in one place patient problems such as the reason for admission and diagnostic information. That's important because it provides a means for quickly and easily sharing information with primary care and other specialty care providers when patients leave the hospital and go to the clinic for additional care. More recently, all of Evergreen Health's hospitalists began making their daily progress notes electronically, whereas previously their notes had been transcribed, printed out, and then put in the paper chart. Now all progress notes are available in the Cerner electronic medical record for any provider to access them at any time, whether in the hospital or in the clinic.
This summer we've brought those notes onto the system with our hospitalists group, and over 2,400 notes have been written through the system, and what's great about that is you can share those notes virtually anywhere, and you're able to now read them because they're now legible. So it's great from a standpoint of sharing data. Second thing we've tried to do is expand the use of our record to all of our ambulatory sites, and so with that we're able to share information both from the ambulatory side to the inpatient side, but all through an integrated record. And we've expanded to our anti-coag clinic this year, our orthopedic clinic, and now our signature care clinic this summer. And then finally, with all the information we have on our patients and some of our ability to monitor remotely, we're able to do a much better job of responding to a deteriorating patient. And so we have a story of where a technician was monitoring the blood gases of a patient remotely. They noticed the deterioration of that patient and were able to call the right code, have all the right clinicians show up at the bedside, and virtually save that patient because of the combination of technology and good process. And so we're excited about the prospect of everything we can do with technology to improve quality and safety.
The electronic progress notes are enabled by natural language processing software to keep typing to a minimum for the hospitalists. Hospitalists are also aided by smart templates that allow them to select which data on the patient they want to include in the progress note. Still another accomplishment of the documentation initiative this year was expanding the Cerner electronic medical record to the anticoagulation unit and to the Woodinville signature care practice. Being on Cerner is particularly important to patient safety for the anticoagulation unit because the records for the patient are now in one place where all the patient's providers can see them. For Woodinville signature care, being on Cerner means providing the higher level of care that its patients expect. Finally, the initiative is on the verge of integrating Cerner and QS, the OB electronic medical record. The integration preserves for OB and women's health users the features of QS that they prefer and makes possible the sharing of information that is a key advantage of Cerner. When the integrated system goes live next month, users will be able to pull up QS and Cerner and have them on the same screen at the same time. And the interfaces between the two electronic medical records will make it possible to send and receive data to and from each system.
The Surgical Home Initiative, sponsored by COO Neil Johnson and led by Dr. Sean Kincaid, Medical Director for Surgical Services, is aimed at reducing the inconsistent readiness of patients having surgery and increasing the focus on the patient's individual needs as they move through their surgical experience. The emphasis has been on patients with comorbidities to optimize pre- and post-surgical care. For example, patients with diabetes or malnutrition that require more coordination of care. The pre-op clinic has been instrumental in identifying patients with conditions that could put them at risk for a more complicated or slower recovery. Dr. Kincaid has remarked on the willingness of various specialties, such as hospitalists, endocrinologists, and anesthesiologists, to work with the surgeons to create processes that ensure a safe surgery experience for patients, from home to hospital and back home again.
Pull, not just push. That was a major objective of the 7-day follow-up appointments initiative this year, directed by executive sponsor Nancy Hoffmeister, CNO. The overall purpose of that initiative is to ensure that hospitalized medical patients receive follow-up care from a provider within 7 days of discharge. In 2015, Hoffmeister's team worked on fulfilling that purpose by making this a pull system, not just a push system. With the push system, the hospital works with the Evergreen Health clinics to schedule follow-up appointments prior to discharge and pushes a list of discharged patients to the clinics. For the pull portion of the system, providers from Evergreen Health clinics reach out to these patients to confirm the appointments or catch those patients that have not been scheduled for follow-up. Lakeshore has partnered with Evergreen Health and is now receiving the lists of discharged patients. Lakeshore follows up to make sure the patient has a 7-day follow-up appointment. Because it is important to track whether the discharged patients actually keep their appointments, the IT staff is creating a report that will be able to provide this information as well. That will close the loop on this important process, which improves patient care and reduces readmissions.
We saw the new Community of Safety website earlier in our broadcast. That's only part of the picture for the Community of Safety Absolute Safety Initiative. The quality team also helped develop a consistent process across the organization to review and follow up on SafeLink reports that had leadership support. And they approved data management within SafeLink to be able to track and trend safety events. The communications team also strengthened safety communications, producing a weekly and quarterly publication about safety. The weekly update is on the Community of Safety website, so it's always current. Many of the stories are about safety events. The team also continues to work on finding and telling stories that represent Evergreen Health at its best. Lastly, the team introduced a new cascade approach to communicating the Evergreen Health dashboard. In the cascade, leaders are provided a summary of the dashboard and managers are asked to share their data with their teams. The summary and the dashboard are also posted on the Community of Safety website.
Helping patients get the right service at the right time and in the right location. That is the strategy Evergreen Health has deployed to achieve their goal of managing patient populations across the continuum more effectively. This year, Evergreen Health collaborated with Wellcentive, a population health software program, to move forward in achieving this goal. Evergreen Health now has multiple shared savings contracts in place and their own self-insured population that requires management of patients for high risk, rising risk, and the gaps of care to improve measures on quality outcomes and ultimately to decrease total costs of care. Evergreen Health's overarching strategy in achieving this goal is to provide patients access to the right type of service at the right time and in the right location. The initiative is led by Monique Rule, Vice President of Clinic Integration and Home Care. The launch of population health software Wellcentive will allow Evergreen Health with risk stratification management and care coordination, outreach calls to patients, as well as identify and close care gaps to improve quality metrics. The organization is on target for all milestones set for 2015, including the implementation of Wellcentive software, creation of a single case management workflow for ambulatory, ED, and inpatients, and creation of disease-specific care templates in Wellcentive with RN case managers.
Evergreen Health is experiencing big success on another front. The Early Detection and Warning System for Deteriorating Patients initiative, sponsored by CMO Dr. Jeff Tomlin and CNO Nancy Hoffmeister. The Rapid Response Nurse has been using a modified early warning system called MUSE, which assigns a score to a patient based on 5 VS components. These include BP, HR, respiratory rate, temperature, and pulse ox. The Rapid Response Nurse reviews the scores. Based on the scores, the Rapid Response Nurse does a proactive assessment of the patient's condition and possible interventions, including transferring the patient to a higher level of care. The MUSE system was developed by the Evergreen Health IT staff in conjunction with Dr. J.J. Cahoon in 2014. They're continuing to refine the system and are currently working on making the MUSE score available in Cerner to the bedside nurse. The rollout in the 4th quarter will also prompt changes in VS frequency when abnormal VS are documented. Later this year, the concept of MUSE will be implemented in the OB population. The scoring has been developed and final phases of the build are occurring. The scoring includes VS, but also other areas such as bleeding, which is important for this population. MUSE is aligned with the rapid response process, which is designed to support nurses when they're concerned about a patient's changing condition. In the 4th quarter, Evergreen Health will be adding a significant component to the program when it introduces a family-initiated rapid response process, allowing families to call a rapid response when they're concerned about changing conditions to their loved ones. All of these enhancements contribute to a proactive safety culture, identifying potential risks before harm occurs to a patient.
Mammograms, colonoscopy, and chlamydia are just some of the preventative screenings that patients are at risk of missing if their healthcare system does not have a proactive system in place. Through the Preventative Health and Health Maintenance Initiative, sponsored by Greg Allen, Vice President of the Evergreen Health Medical Group, Evergreen Health has implemented a system to increase the number of patients receiving preventative screenings and other care, leading to earlier detection and better patient outcomes. The system is designed to improve patient care, increase performance in public reporting, and align with payer contract priorities. Work is ongoing to ensure the data is captured in Cerner, which allows other providers throughout the system to have access to this information.
Evidence-based nursing practice initiative magnet recognition is sought after by hospitals across the nation. Magnet recognition is awarded by the highest body in nursing, the American Nurse Association, through the American Nurses Credentialing Center. The program recognizes excellence in organized nursing services. Only 7% of the hospitals in the country have achieved this level of recognition. The Evergreen Health dashboard shows great progress on the measures that must be at best practice for at least 8 quarters before a reasonable attempt can be made to begin applying for magnet recognition. These measures include falls with injury, hospital-acquired pressure ulcers, central line-associated infections, and catheter-associated urinary tract infections, or CAUTI. Here are the results. falls with injury have been reduced by 27% since 2012. An opportunity was found with moderate to severe injury falls, and this has been the focus in 2015. Results show that falls with moderate or severe injury have been reduced by 58% from 2014 to 2015 year to date. Hospital-acquired pressure ulcer stage 2 and beyond has seen a 94% reduction since 2012. Central line-associated bloodstream infections, CLABSI, is another important magnet measure based on central line days. Evergreen Health is already at best practice for central line days, and it has seen a 51% decrease in central line infections since 2012. Catheter-associated urinary tract infections have seen a 38% decrease since last year. This indicator has been variable over the years. Evergreen Health implemented a nurse-driven Foley removal protocol in 2013. In the fourth quarter of this year, Evergreen Health will roll out a urinary retention protocol to help continue the trend of decreasing CAUTI. In part, through improvement on these measures, Evergreen Health continues its journey toward excellence in nursing care. Evergreen Health is currently at performance levels related to quality outcomes on these 4 mandatory magnet indicators that will enable it to meet the necessary criteria for recognition application. Chief Nursing Officer Nancy Hoffmeister cautions, though, there are other hard stops that Evergreen Health must work on before moving forward formally with magnet recognition.
Coming later this fall, more opportunities for team-based simulations. Evergreen Health's Director of Quality Management, Kathy Schoenrock, explained that team-based simulation provides a unique opportunity for teams to learn new skills and processes, and more importantly, to practice them as a team. This fall, simulation training for code blues and heme alerts and difficult intubations are scheduled for the clinical staff that responds to these events. This training reinforces Evergreen Health's commitment to absolute safety as the organization prioritizes the time to have teams sharpen their understanding of the processes and their roles to play in these emergency situations.
Here's a final thought before we end our broadcast. It comes from CEO Bob Malty.
I'd like to thank all of you for the work you do every day, for your commitment to our patients, your commitment and passion for great clinical care, and for our commitment to what we aspire to become. When we talk about our vision statement for Evergreen Health, the words we use are creating an inclusive community health system that is the most trusted for health care solutions. And when we think about that word trusted, that word trust is earned every day. It's earned in every patient experience that we have. It's earned in every moment that we are with that patient and their family and their friends. And that trust comes from not only the great clinical outcomes that they have come to expect from Evergreen Health, it also has to do with the great experience they have while we're caring for them, and it has to do with them knowing that they are absolutely safe, not just safe, but absolutely safe in our care. And I'm proud beyond belief and humbled by the work that you do. The journey that we are on is an important one. As you've heard in the stories in this video, we've done a tremendous amount of work and improvement in this past year and the year we're in, and our work is far from done. And the work that we are doing now in the next year and the year after that are equally as important. So on behalf of the board, on behalf of the entire leadership team, and perhaps most importantly on behalf of our community, thank you for everything you do every day.
Right before this broadcast started, we heard from patients about the year that Evergreen Health has had. Here's some of what they had to say.
They said thank you to staff and physicians for your many contributions to safety and quality at Evergreen Health. Clearly, this has been a year of great aspirations and accomplishments. We are especially pleased to see how you are putting a real safety management system in place and gratified overall by your progress on the 9 safety and quality initiatives of 2015. We know that you will make this vision of becoming a community of absolute safety a reality.
That's it for our broadcast today. Thank you for joining us. I'm Margot Myers.
And I'm Dick Foley, wishing you all a good day from all of us at KMEH TV.
Coming up next, Dr. Mark Newman will be sharing your feedback from the Quality and Safety Retreat pre-work questions. Stay tuned.